Hi everyone, I am Dr. Anthony Dakpallah, but you can call me Tony for short. Welcome back to our series on pregnancy scans. So far, we've talked about what happens in the first and second trimester scans. Today, we are focusing on the third trimester, the final stretch of pregnancy, and the stage where both mom and baby are getting ready for delivery. So when is this scan done and why? The third trimester scan is usually done between 32 weeks and 36 weeks, though your doctor might request it earlier or later depending on your situation. At this point, we already know your baby's anatomy and development. So this scan focuses mainly on growth, position, and well-being. We want to answer three big questions. Is the baby growing well? Is the baby getting enough oxygen and nutrients through the placenta? The placenta is what attaches you to the baby, and that's where the baby gets his nutrients from. And three, is the baby in the right position for birth? What are we looking for during this scan? Let me break it down. First, we check the baby's growth. We measure the head circumference, the abdominal circumference, and the femur length, similar to what we did in the second trimester scan. These measurements are compared to standard growth charts to make sure that the baby isn't growing too slowly or too fast. Next, we assess the amniotic fluid. That is the fluid around your baby. Too little or too much can be a sign that we need to monitor things more closely. So we look at the placenta, where it is located, how mature it looks, and whether it is functioning properly. And then there is the baby's position. Is the baby's head down? That's what we refer to as cephalic position. Or it is breech, where the bottom is down. So the baby is coming with the bottom. Knowing that helps your doctor to plan for delivery and decide if you might need another scan closer to term. We also do Doppler scans in some cases. And this is a special type of ultrasound that checks the blood flow through the umbilical cord and the placenta to make sure that your baby is getting enough oxygen and nutrients. If you have conditions like high blood pressure, diabetes, or previous growth restricted pregnancy, your doctor may recommend these extra tests. We may also look at the baby's breathing movements, the muscle tone, and general activity. These are all signs of good health inside the womb. And what will we be doing? What will we see during the scan? So by now your baby is much bigger. So you might not see the whole body at once like you saw in earlier scans. But you will still see amazing detail like your baby's face, the hands and movements of the hands. You might even catch them yawning or blinking. It's one of the sweetest parts of this journey. If the scan shows that your baby's growth is a little behind, your doctor might schedule more frequent ultrasounds to keep an eye on things. Sometimes you might be advised to deliver a bit earlier if the placenta isn't functioning well. And if the baby is in a breech position, your doctor will discuss options like turning the baby or planning a C-section. Yes, sometimes we are able to turn the baby from outside, but it's not always successful. They may have to consider a lot of factors before they do this. So the important thing is that the scan helps everyone, you, your obstetrician, and the radiologist. make safe and important decisions before delivery. So, the third trimester scan isn't just a formality, it's a safety check, and it's a way to make sure that your baby is thriving and ready for life outside the womb. It gives peace of mind to both the parents and the doctors, and it ensures that any last minute concerns are handled with care. So, that's what happens during your third trimester scan, the final chapter in your pregnancy imaging journey. If you've enjoyed this series on obstetric imaging, please give this video a like, subscribe, and share. Share it with expecting parents or anyone who is curious about pregnancy care. And remember that every scan tells a story, and yours is one of growth, love, and preparation for a brand new life. Thank you for watching, and I will see you in the next episode. Cheers.